Bismillahirrahmanirrahim. Assalamu alaikum. Have you ever experienced sudden episode of intense fear? You felt your heart pounding, shortness of breath, and an intense fear you couldn't explain. You thought you were having a heart attack. Well, today I want to talk about something millions of people deal with every day: panic disorder. And I will explain it through a story. I want to share case history to understand panic disorder. Meet Miss Sarah. Miss Sarah is a 30 years old teacher who recently began experiencing sudden episodes of intense fear. At first, she thought it was just stress, but the symptoms felt overwhelming. Her first episode: one day while shopping at the mall, Sarah suddenly felt her heart pounding, shortness of breath, and an intense fear she couldn't explain. She thought she was having a heart attack. Within minutes, she felt lightheaded, started sweating, and thought she might faint. She left the mall immediately, but the fear lingered on. Impact on her life: after that episode, Sarah began avoiding malls and crowded places, fearing another attack. The panic attacks didn't stop. She started waking up at night feeling the same way. This led her to avoid social gatherings, and her world grew smaller as she became increasingly anxious about when the next attack might strike. Seeking help. Finally, Sarah consulted me. After a detailed evaluation, she was diagnosed with panic disorder, a condition where the body's fight or flight response is triggered without any real challenge. Treatment and recovery. Sarah started a combination of cognitive behavioral therapy to understand and manage her thoughts, and medication to control the severity of the attacks. She also learned breathing techniques and practiced mindfulness, which helped reduce her anxiety over time. So, the key message from this history is that panic disorder is treatable and seeking help early can prevent it from taking over your life. It's important to recognize the symptoms. And the symptoms of sudden intense fear without a clear cause, heart racing or palpitations, sweating, trembling, or difficulty breathing, finding detached from reality, or fearing loss of control. Panic disorders are anxiety disorders characterized by recurrent panic attacks. The criteria which we follow is number one, recurrent panic attacks, at least one panic attack followed by 1 month of persistent concern or worry about future attacks, and significant change in behavior related to the attacks. We understood the panic attack symptoms. These are number one, sudden onset of intense fear or discomfort. Number two, peak intensity within 10 minutes. And it should be accompanied by 4 or more of the following. What are these? Palpitations or rapid heartbeat, sweating, trembling or shaking, shortness of breath, feeling of choking, chest pain or discomfort, nausea or abdominal pain, dizziness or lightheadedness, fear of losing control or dying, and tightness or numbness. There are different types of panic disorders. For example, panic disorder with agoraphobia, panic disorder without agoraphobia, and agoraphobia without panic disorder. What is agoraphobia? It's a type of anxiety disorder. A person with agoraphobia is afraid to leave environments they know are considered to be safe. In severe cases, a person with agoraphobia considers their home to be the only safe environment. They may avoid leaving their home for days, months, or even years. What are the causes? Research has shown that the causes and risk factors for panic disorders are genetics, brain chemistry, life experiences like trauma and stress, medical conditions like thyroid disorder, substance abuse, family history, and personality traits like anxiety sensitivity. How we doctors diagnose the panic disorder? Of course, by comprehensive diagnostic evaluation, psychological assessments, medical history, physical examination, and applying the diagnostic criteria DSM-5 or ICD-11. In the treatment, different medications are being tried like serotonin reuptake inhibitors, serotonin, norepinephrine reuptake inhibitors, benzodiazepines, antidepressants, etc. But these has to be prescribed by a qualified doctor. Different psychotherapies are implemented, and these include cognitive behavioral therapy, exposure therapy, acceptance and commitment therapy, and dialectional behavior therapy. Lifestyle changes has got very intense and important role, like having regular exercise, mindfulness attitude, relaxation techniques like deep breathing, healthy sleep habits, balanced diets, and stress management. So, dear, if you or someone you know experiences these symptoms, don't hesitate to consult a healthcare professional. Help is available, and this is a condition which is 100% treatable, curable, and controllable. So I end here. Inshallah, we see you in another vlog on such health topic. Till then, take care. Khuda Hafiz.